Well, in a nutshell, that it is not going very well. Dr. Tedros slammed what he called an imbalance, a shocking imbalance when it comes to the global vaccine distribution, where, unsurprisingly, you have rich developed nations far outpacing lower and middle income nations. He said that when it comes on average to high income countries, 1 in about 4 individuals have received a vaccine, but that drops to 1 out of more than 500 when you look at low-income countries. So there is this huge divide between the haves and the have-nots. Now, there are a couple of reasons behind this, actually a lot of reasons behind this, one of them being that vaccines are still relatively scarce at the moment, and you have a lot of these developed nations which have put in these gigantic orders for vaccines, enough vaccines to vaccinate their populations many times over. You also have the production process, which has not been as quick or as smooth as many had hoped for, and this has led to supply shortages, and this has even hit the COVAX facility, the global sharing facility that was meant to give greater access to low and middle income countries. They were meant to deliver about 100 million doses by March, and that has only been 38 million, we heard. Well, one way to narrow this divide would be to waive patents and intellectual property rights on vaccines and other COVID-19 related technologies. This is something that would allow production to take place in many more facilities and facilities that are much closer to the countries that need these vaccines so desperately. South Africa and India have been pushing quite aggressively for this at the WTO. About 80 developing nations have gotten behind this initiative, but it is the developed nations which are standing in the way, including the United States and Europe. There are also infrastructure challenges. Some of these vaccines require cold chain storage and movement, and they need more refrigerators to be bought. They need to train these healthcare workers so they know how to administer these vaccines properly. Another way to help solve this problem is to scale up manufacturing. If there is any idle capacity in the world, to get those manufacturing facilities online. The World Bank president saying today that there also needs to be greater transparency when it comes to the contracts which have been agreed to. And of course, money is needed. COVAX needs more money. The institutions that are behind COVAX need more money so that they can put these systems into place. And the thing that's really interesting here is that, and something that was discussed, is that even if a country manages to have 100% immunization, that could be rendered completely useless, because if this virus is allowed to continue to circulate and to spread and to mutate, then those mutations could render the current stable of vaccines useless. So this is why it is so important to really ramp up the global rollout of vaccines.